Hi, my name is Dr. Rudra Mohan, and through the Coronally channel today we are going to be talking about coronally advanced flap surgery without vertical incisions. Let's start. So in the previous episode I talked about coronally advanced flap surgery for isolated gingival recession defects which actually had a depth of less than 3 mm and adequate width of keratinized tissue that was about 1 mm. I had also spoken about a modified coronally position flap that was basically where we do the full split thickness design. However, we know that the blood supply or the anatomy of the blood vessels of the jaws, they actually run in an anterior posterior direction. So if we give vertical incisions, there is a high likely chance that there is damage and disruption of that blood supply that can lead to post-operative swelling, complications such as keloid formation and scar formation. So Giovanni Zucchelli and DeSantis et al. Actually came up with another solution to it, which was another modification of the coronally advanced flap that was done without vertical incisions. So this study was carried out and it was actually observed that instead of doing the vertical incisions for isolated gingival recession defects, they did it for multiple recession defects around the anterior teeth with having the gingival recession depth less than 3 mm and obviously with the adequate keratinized tissue width of 1 mm, and they created an envelope flap. Now an envelope flap is basically where you do not put any vertical incisions and you give all the incisions through the sulcus, that is the gingival sulcus that is around the tooth. Now it's very important to note that they had created this process where they had created surgical papillae with the help of oblique incisions at the line angles of the teeth, that was multiple teeth with gingival recessions, to create new surgical papillae, and they had de-epithelialized the anatomical papillae. After releasing those incisions with the help of the envelope flap, they made sure that the envelope flap was raised with the help of a full split thickness approach, the same way as the coronally advanced flap, that modified coronally advanced flap was done without any vertical incisions, and they put it and pushed it coronally downwards and put the sutures around that. The operation time of the coronally advanced flap without vertical incisions was actually comparatively lesser compared to the one with the vertical releasing incisions. And also we had found that the odds of having any sort of complete root coverage that was better was 3.76 times in the coronally advanced flap without vertical releasing incisions. Now the rationale behind this is very simple, as I've told about the blood supply that runs anteroposteriorly, that is not disturbed. Because of that, the time was reduced, because of that the post-operative swelling was reduced, and because of that we avoided any scar formation or keloid formation because of vertical incisions. So if you're a periodontist or if you're a practicing dentist who has any cases that have multiple gingival recession defects of less than 3 mm with adequate keratinized tissue width, you can get in consultation with your periodontist and see and evaluate clinically as well as radiographically. If the case permits, you can go for this envelope flap approach for coronally advanced flap. So this was today's episode. Please like, share and subscribe, and do press the bell icon for important updates. If you want to get in touch with me, kindly refrain from calling me directly. If you want to contact me on social media, here are my social media handles, and you can drop me a WhatsApp message to have a tete-a-tete with me and you can have a word. If you are a spectator or an audience member and you feel like that whatever that is required is helpful for you, or you have any queries, apprehensions or doubts, feel free to drop in a comment in the comment section of the YouTube. So that's it for today. Thank you.